So what is PCR? Well, PCR stands for polymerase chain reaction, which falls into the broad category of nucleic acid amplification tests. PCR is a method that amplifies small segments of DNA, which can then be utilized to identify bacteria, fungi, viruses, and other microorganisms in a clinical specimen. The process can be simplified into 3 steps. First, the DNA obtained from a sample is denatured, meaning the double helix is unzipped, so to speak, and separated into 2 DNA strands. Secondly, annealing takes place, which involves primers binding to the DNA strands. Thirdly, elongation or extension of the DNA strand occurs. The cycle continues for about 1 minute and is then repeated 30 to 40 times. The amplification is exponential, which can lead to 1 billion copies of the original DNA segment. If a certain microorganism or pathogen is present that matches one of the primers, it will be detected and identified. The amount of cycles it takes for the machine to detect an organism has an inverse relationship with the amount of organism that is present in the specimen. For example, if there is a high amount of E. coli present in a patient's urine, the machine will only need 10 to 15 cycles to detect it, whereas lesser amounts of E. coli may require 30 to 35 cycles. This specific amount of cycles is often reported as the microbial load of an organism, which is similar to CFUs reported by traditional culture. How does PCR differ from traditional culture and sensitivity? First, and probably the most significant in the clinical setting, is turnaround time. PCR takes anywhere from 2 to 4 hours for the entire process to occur. For traditional culture, the soonest results may be available is 48 to 72 hours. Factoring in the shipment of a specimen to the lab, clinicians can generally expect to receive PCR results within 24 to 48 hours of obtaining a specimen, whereas culture generally takes 3 to 5 days. This makes PCR huge for clinical practice, allowing providers to prescribe appropriate antimicrobial agents sooner and de-escalate therapy when appropriate. Another difference is that traditional culture requires growth of an organism on a plate. Certain organisms grow very slowly and may require specific growth conditions, often limiting their detection. PCR generally does a great job of detecting present organisms. However, PCR differs in the fact that it can only detect organisms that have matching primers. This means that the specific list of targets that are being tested for on the panel are the only ones that could be detected if they are present. Next, PCR and culture differ with how they report antimicrobial resistance. Instead of testing for susceptibility of organisms to specific medications as culture does, PCR tests for the presence of resistant genes. These resistant genes are known to express mechanisms of resistance to specific drug classes. For example, if E. coli is detected along with a fluoroquinolone-resistant gene, this means that a fluoroquinolone is unlikely to be effective and the E. coli is resistant. Another big advantage of PCR is its ability to detect organisms involved in polymicrobial infections. Traditional culture can generally detect only 2 or 3 organisms on an agar plate. Anything greater than 2 or 3 organisms will be considered a contaminant or listed as mixed flora. PCR will detect as many organisms that are present, making identification of polymicrobial infections possible and immensely aiding in treatment decision-making. In addition, PCR is not affected by the presence of biofilms or previous antimicrobial use. Organisms that are difficult to detect or are often missed by traditional culture are often able to be reliably identified by PCR. In summary, PCR is a novel technology that involves amplification of small segments of DNA to detect bacteria, fungi, viruses, or other organisms. It has fast turnaround time and is able to reliably detect organisms in situations where traditional culture may not. It has proven to be an effective tool for clinicians streamlining care for infectious diseases and ensuring best antimicrobial stewardship.